Joining me now to talk more about the resources and financing for the world's AIDS response is Kevin Fisher. He's the Director of Policy, Data and Analytics at AVAC, and he joins us now from New York. Welcome to the show.
Thank you for inviting me. It's great to be here.
Now, looking at global fundraising for this issue, which countries are really leading in those efforts?
Well, the U.S. has always traditionally led, and either through the President's Emergency Program for AIDS Relief, PEPFAR, and also for contributions to the Global Fund. The Global Fund is also leading in this regard. I would also say that there's a lot of low and moderate income countries that are stepping up in terms of their contributions. And I think if you look at the UNAIDS reports, over 50% of the response in lower and moderate income countries comes from the countries themselves. So that's an emerging area of greater investment, and though it's flattened somewhat in 2015, 2016.
And how do you think the current funding matches up with what's needed?
Well, as you said in the intro, we have about a $6 billion deficit, which we really need to make up if we're going to treat everybody. And as you also noted, there's about 16 million people that still are without treatment. I think one of the emerging questions and one of the emerging challenges is what's called the youth bulge, which is the number of young people that are now being born, and that in fact in Africa, I believe that between 2010 and 2030, there will be another 100 million people be the age of 15 to 24. And if we don't get actually prevention for those people and also treatment for the other people who are now currently living with HIV, that we really could face a real problem. And so it's really critical that we ramp up our investment now.
And speaking of that investment, what share of the funding is spent on, say, research and prevention versus care and management after diagnosis?
The vast majority of it is care and diagnosis. Some research, we've done an estimate of, I think, an estimate is probably about $1 billion that's spent on HIV prevention research. There's probably an equivalent amount spent on treatment. There's still a lot of work, even though we have very good treatments now. There's a lot of really interesting and good work being done on treatment. There's an injectable, long-acting treatment that's being tested and is being introduced as well. So there's probably a good bit of investment there, but the primary investment still remains care and treatment. Prevention is a smaller piece of that as well.
Now, what role is technology and as well as social media playing in the fight against HIV and AIDS?
Well, social media is tremendously important, and a lot of the different, I think a lot of holding governments accountable in terms of their AIDS response. Social media has become tremendously important in terms of activating civil society to call upon their governments to have an AIDS response. On the technology side, there's tremendous. Actually, it's actually kind of a golden age for research. There's 2 HIV prevention trials now ongoing. There is a trial of something called the depivirine ring, which has an antiretroviral, which is vaginally inserted, and women could use for up to a month, which is now pending before the European Medicines Agency. And there is also a long-acting injectable kind of PrEP, which is a pre-exposure prophylaxis, which is use of an antiretroviral as prevention. So you would take it once a month, but this would be an injectable that you might only take twice every 2 months. So there's a lot of technology that's going on and a lot of diagnostic work. It's actually a very rich period of time in terms of the research.
And let's also look at some of the health and other socioeconomic issues that contribute to the spread of HIV and AIDS. For example, the link that we're seeing between the opioid epidemic and the spread of HIV. Can you tell us more about that?
Yes, I mean, that actually really, at least in my country, in the U.S., came to fore when there was a number of infections that occurred in a town called Austin, Indiana, which is a very small rural community, which has a lot of people who had substance use disorders in terms of and using opiates and heroin, and they were sharing needles. And so in the end, I think it's close to 300 infections caused by just a small subset of people who happen to be sharing needles, and so that's a continuing problem. And it was actually in the context of actually a reduction of some of the HIV counseling. So there were a lot of people there who were sharing needles and weren't even aware that could be a way that HIV could be transmitted. So there's a lot of education that needs to be done. And I would also say that that's also related to the hepatitis C epidemic that also occurs at the same time, because that can occur. For example, in the United States, there's about 4 million people that are now currently infected with Hep C too as well.
And just quickly, in terms of the top priorities in the fight against HIV and AIDS, if we could just quickly say, what would they be?
I think, well, you identified the one really in your beginning, which is in terms of sub-Saharan Africa, how we get men treated and how we get men tested, and that's really critically important. People are doing a lot of work with self-testing. Men, originally they used to test men in bars. Men don't really want to be tested in bars. Then also, I think, as you identified, finding out a way to protect young women and adolescent girls from infection. There's a lot of really interesting work that has just been announced by PEPFAR in terms of their DREAMS program, which showed a 25 to 40% reduction in many high-burden areas. So that's really critically important. And then thirdly, just figuring out a way what we're going to do about the youth bulge and how we're going to fund some of these things. And I think that, I think that there are a lot of ideas for funding, but we still have to clarify about how we're going to do that.